The UN Security Council met on Friday to discuss how to help the starving people in Syria after a reported 32 deaths in Madaya last month. The UN says there are almost 500,000 people trapped in and around 15 different siege locations across Syria. The World Food Programme said that figures were provided on the extent of the starvation, but it could not verify them. The World Health Organization said a mobile clinic and a medical team from the Syrian Arab Red Crescent was on its way to Madaya after the government approved an urgent request. And a vaccination campaign is planned for next week. The US accused the Syrian government of not dealing with the issue, but Syria's deputy UN ambassador defended his country's actions.
We must stop acting as though such suffering is simply inevitable. In the last year, the Syrian regime did not even respond to more than half of UN requests to deliver assistance across conflict lines. According to the UN, if the regime approved these outstanding requests, 1.4 million people would receive assistance.
Some attempt to say that access to humanitarian assistance for troubled areas can be achieved simply by the Syrian government accepting all of the United Nations demands, and then the aid will be delivered, and that we should simply accept this assistance as if it was nothing more than an administrative procedure. This, of course, is a simplistic way of saying things, and is not in keeping with the facts on the ground. There are a number of considerations which cannot simply be ignored. We are referring to providing assistance in dangerous areas where armed terrorist organizations are active, including ones which have been listed by the Security Council.